Being surrounded by the natural world, I think, is just really invigorating. Being able to drive into a garden as your workplace versus drive into an office building is just a wonderful thing to be able to say and do. That I can be out there without any hip pain is really a blessing, and I don't take it for granted. It was just so searingly painful, and it just showed up in all kinds of ways. My lifestyle is pretty active. I like to take walks, we like to hike, Pilates and strength training and yoga. So recognizing after a prolonged period of time that it wasn't going away was quite honestly depressing. The surgeon that I was seeing, he's the one that ordered the MRI. Those results really indicated that there was a lot of deterioration in my hip and I would benefit from a hip replacement. And that's when I came to know of Dr. Stevenson.
Hey, Dawn! So good to see you. You look great. See you. Come on out.
When I met Dawn, she had completed over 7 months of physical therapy. She was taking anti-inflammatories every single day. So she finally came to me at a point where she felt like she could not continue on the path that she was on. With a posterior approach and other approaches, you're typically having to take down 1 or 2 muscles to gain access to the hip. That requires sometimes some additional physical therapy, some additional rehab, sometimes a longer rehab. With a direct anterior approach, we're coming down between muscles. That helps maintain soft tissue attachments. It's less trauma to the surrounding muscles during the procedure. And the benefit of that is it leads to a faster initial recovery and fewer postoperative restrictions, again, because we're not violating those muscle planes. I'm just gonna move your hip around. I just remember that I really sought out a fellowship where this is what I learned to do and this is my niche. And the reason is because these patients do so remarkably well. You see people at 2 weeks and you think that they're a 6-month post-op hip. They're already getting back to what they wanna do. They're begging me to let them drive.
She was just so confident about how she does surgery and what her outcomes are. It just gave me a lot of comfort in the person she was. Having PennMedicine Chester County Hospital literally right down the street is a wonderful privilege. But honestly, Dr. Stevenson could have told me she needed to operate 50 miles away and I would have followed her. That's how much I believed in what she was going to do to get me back on the road to my active lifestyle. Probably by day 4 or 5, I was seeing a big difference. I was a lot more independent and a lot more comfortable.
What I remember about her post-operatively is she walked into my office at 2 weeks with no cane. She was zipping down the hallway and ready to get back to her job within a month. That is incredible, and that's what I expect for my typical hip replacement.
It was such a seamless transition from before the surgery and after the surgery, and it gave me such great results that I just live my life and actually don't think about it.
Hearing patients like Dawn, where she's getting back to everything she wants to do and more. She's traveling, she's doing Peloton, she's doing her hiking. That just makes me feel very blessed to have a part in their care and motivates me to keep providing that level of care to others.